Good day everyone. This video is specifically for Hubbard Tank. As we all discussed in the previous video that it is a full immersion tank, butterfly shaped, and it is used mainly for the patients who are unable to stand. It is used for underwater exercises. It has jets, support bars for doing exercises, and its shape it has a wide top and bottom, but it have a narrow middle area. And in this, the patients are lowered on a stretcher by an overhead hydraulic hoist. Majority of the time there are two turbines and that can be moved around the whole perimeter. Talking about the equipment, the Hubbard tank is designed for permanent installation with direct connection to hot and cold water supply, overflow and drainage. Also, there is one digital thermometer to measure the temperature of the water. The basically the narrow middle area, it provides good access for the therapist when monitoring or assisting the patient with exercises. Various accessories are also available with Hubbard tank, including the stretcher, sitting seat and headrest. In this video, you are seeing this turbine which could be moved around the perimeter and it can be placed according to the patient's requirement. If the patient is performing the exercise in the direction of the flow of the water, turbined water, then it will assist the movement, and if it performs it in the opposite direction, then it will resist the movement of the patient. Further in this video, we will see that how a therapist can assist the performance of various exercises. So in this video, you can see that movement of turbine, water and the equipment. The pressure and direction of the turbine water can be adjusted or controlled. Now in this part of the video, we will seeing there will be how the stretcher is prepared. The hoisting stretcher is preparation has been shown. We have to secure the patient on the stretcher. Mostly you can see the patient is walking with by itself, but majority of times the patient for we use the Hubbard tank is mostly bedridden or is unable to stand. So we have to properly secure the patient on the stretcher. Then we have to attach the patient's hoist, and we have to hoist the patient with this pulley system. Now we are hoisting the patient, and very carefully we have to lower the patient into the Hubbard tank under the water. While lowering the patient into the water, we have to support the patient's head, and we have to adjust the headrest to the comfortable position. Once the patient is comfortable, we detach the hoisting ropes so that the exercises could be performed. Before commencing the treatment, always make sure that the patient is comfortable and is not afraid. So you can see that narrow area of the Hubbard tank that helps the therapist in assisting the patient. So over here, the shoulder movements are being performed by the therapist. Therapist is assisting the movements. Similarly, the knee and hip exercises are being performed. In this, knee flexion and extension is being performed by the therapist. So therapist can either perform the passive movements, or sometimes more or majority of times they assist the movements by asking the patient to initiate the movement, and they assist the movement. Now for performing the hip flexion movements or the hip joint mobilizations, we have to change the position of the patient. So hip mobilization has been performed. After all the exercise session, we have to reassess the patient after every session. So after the performance of the exercises, we are hoisting the patient out of the Hubbard tank. So we have to attach the patient hoist again, and very carefully we have to lift the stretcher back to its original position. Always give time to the patient while lifting it back, or we have to reassess the patient after every session. At last but not the least, the most important thing is the hygiene. We have to clean and dry the equipment and drain the tank at the end of the day after cleaning the turbine shaft. Thank you.